talking about that, let's talk about some of the cuts that we can look forward to coming forward. So now that we have Donald Trump is going to be president again in January on the 20th. He gets inaugurated, and he's got a lot of plans for cutting things and tariffs. But the big ones that are going to come down the pipeline right away that we need to be worried about are cuts to healthcare, which are going to come pretty quick starting next year. So just want to make sure everybody's ready for that. So here's just a quick article. So it just Trump's healthcare plan is to let insurers charge more for pre-existing conditions. So they're looking at what the plans were, essentially. They haven't given anything in detail, but we know certain things are coming down the pipeline for sure. So Donald Trump infamously said that presidential debate he had concepts of a plan to replace Obamacare. So for those of you who don't remember, he said he was going to replace Obamacare back in 2016. He said it all through his presidency. We got a new plan. We got a new plan. It's going to be better than ever. It's the better than everybody gets health care, blah, blah, blah. Said that for 4 years. It was coming out next week. Every time he said it was next week, next month. It's coming out. It's coming out. It's coming out. Mañana, mañana, mañana. Never happened. Right? But they tried to cut Obamacare completely and get rid of it. And they couldn't because it's too popular. But but now they have the House and Senate, so it'll be a lot easier. So JD Vance came up with not only a surprising, but if understood properly, far more damaging than Trump's original statement. The Trump plan, according to Vance, is to permit insurance companies to discriminate against people with pre-existing conditions. So Vance explained the Trump plan during the interview with NBC's Kristen Welker. He, of course, does have a plan for how to fix American health care, but a lot of it goes down, Kristen, to deregulating insurance markets so that people can actually choose a plan that makes sense for them. Vance is advocating a partial or complete return to the system that existed before Obamacare. In that world, prior to 2014, it was very difficult to find affordable coverage unless you were on Medicare, Medicaid, or got insurance through your employer. There was a market for individual insurance, and it was possible to buy plans if you don't get coverage through a government plan or through work. But that market was dominated by adverse selection. So for those of you who don't know, in the insurance industry, especially in healthcare, they rate you, healthcare and life insurance, they rate you from either an A to a G. And I think A is the best. So if you're an infant with no health problems, you're an A quality. Because the odds that you're going to get sick or die are lower, right? In life insurance. In healthcare, if you're an infant, you're probably going to get sick. So you're probably a C or a D. And then that's how they gauge what your insurance rate's going to be. Is they classify you into these categories based on what they think the risk is. So adverse selection is when you're an F and H or a G because you are really down on the scale. So it doesn't do me any good to insure Lacey. Lacey has cancer and she comes to me for health insurance. I'm probably going to say no. Why? Because the odds are I'm going to be paying her more to pay for her health insurance and she's going to be paying me in premium. So I'm going to be losing money. So why would I invest in that? It's too high a risk. It's just if you have a triple bypass, and I've seen this before, guy has a triple bypass, he's knocking on death's door and he wants to buy life insurance. You're like, yeah, no, nobody's going to sell you life insurance. Because the odds that you're going to die soon and they're going to pay out more is almost guaranteed. Right? So that's how insurance works. They can't, unless there's a chance to make money, they're not going to do it. So they avoid that kind of stuff. So when Obama came in, they did that whole thing about pre-existing conditions, and it was a big deal. It forced insurance companies to take people they normally wouldn't take, which is not profitable. But what it did on the other side of that was Obama wanted to put in the individual mandate and pressure people, especially younger people, to join in, because now if Lacey comes in and she's an adverse selection because she's got cancer, but you're like, okay, so you got to cover Lacey. And I'm like, well, I'm the insurance company. I'm like, well, that sucks. I don't want to do that. But then they're like, yeah, but we're going to bring in these 200 other young people who are healthy, who are not likely to get sick. And you got to cover them too. Well, now I'm getting all their premium. It offsets it. It's fine. But what they're saying is, let's take that away. Where you're also forcing me to not just take Lacey, but all these other people come with her to make it affordable for me as the insurer. Vance is saying, no, we're going to take that away and let everybody choose whatever they want, which means me as the insurer, now I'm not covering those people. So now a lot of people, and just an estimation, you're looking at 25 million people are going to lose insurance that are sick. So that's what that pressure is, and there's a good chance they'll get that passed through. So,
Oh yeah, most likely, almost completely certain that they will get that passed.
yeah. Well, and part of what helps that is the uh, I got this article from Yahoo, the why the Affordable Care Act is in real trouble this time. So this is what's happening coming up. All right. So far, GOP leaders have been vague about what's exactly they might do. During his debate, the president-elect said he had concepts of a plan. Yeah. Let's see. But there's one key reason to think that this time it will turn out differently. A major expansion to the Affordable Care Act's insurance subsidies passed by the Biden administration is currently expected to expire after 2025, which will lead to large premium and deductible increases for many Americans who get their health coverage through program exchanges. So if you've got your health coverage through a program exchange or you have Medicaid, a lot of those subsidies that the government put in to lower your insurance cost are gone after 2025. So that means Republicans can pare back Obamacare without lifting a finger. But the looming subsidy cliff might also give a party political cover to make broader changes that would otherwise be difficult for moderate lawmakers to swallow. So what happened was Democrats temporarily made Obamacare insurance tax credits more generous as part of Joe Biden's $1.9 trillion American Rescue Plan. Those changes to the law subsidies, which lower the cost of health coverage purchased on federal marketplaces, knocked premiums to zero for many lower-income families, while further limiting their out-of-pocket expense. So a lot of people right now that normally wouldn't have coverage, and they're not paying anything for it because the government subsidized it. That expires, now all of a sudden they're either going to lose the coverage or they're going to have to start paying the premium, which could be, depends on the person, it could be anywhere between $500 to $1,500 a month, which is going to be devastating. And in order to keep that in place, the Republicans might come back and go, well, if we're going to do that, let's just overhaul the whole thing, which could be even more worse or devastating. So, and I misquoted. It's not 45, it's 25, it's 45 million Americans. Sorry. So that's a fourth of the working population almost. It's like 40%. Or 24%, something like that. So, get ready for that. If you're making less than $70,000 a year, get prepared that you might have to start paying for your health care that you were otherwise getting by without. And if you have kids, this is really, time to be a little bit scared. Maybe I'm understating that. A lot scared. So that's what's going on with that. Let's see. With the who's going to cover that? We could do this. The Medicaid expansion. Yeah, we can skip that for now. So that was that. So let's see. Hang on, I'm having a delay here. So with the Medicaid, yeah, they're not going to do the Medicaid expansion, so that's going to be a big deal. So what happened was when they did Obamacare, the Affordable Care Act, Obama also put in an expansion for Medicaid with all these states and said, okay, we're going to cover and pay for Medicaid, right? And what happened was there was a big expansion in that gap, what they called the pay gap, because most people don't qualify for Medicaid. You have to be poor. I think it's like for a single person, you got to be making less than $17,000 a year to qualify for Medicaid, and for a family, it's like less than 30 or 35. So you have to be making nothing. Well, there's a lot of people. a lot of people between that amount and 60, 70,000 that can't get health insurance, or if they can, it's just way too expensive because even for like a single guy like me, it's about like 1,200 a month.
Sure. I mean, imagine you're a single person, you're making $30,000 a year. You make too much to get on to, the
Right.
state plan. And how on $30,000 a year are you going to be able to afford a $7,000 a year insurance plan?
Oh, more like 12. Yeah.
It was 7 with all of these great subsidies.
Yeah.
You know, that's
Well,
that's what it looked like with the subsidies, and all of that stuff's going to go away, right?
right.
But even currently, where it's like $7,000 a year, that's already like a quarter of your freaking income, right there, and that's about to go up.
Well, yeah, and
So,
the expansion on the subsidies covered a lot of that 7, so you weren't paying hardly anything. So now all of a sudden that's all going to go away. So now you either have no health insurance unless you can get it through your employer, but if you're making less than 50, your employer probably not covering health coverage. And we covered that before. Less than half of American workers have jobs that cover health coverage. So now you're really screwed. And, as anybody who knows, you get one, negative, you have to go to the hospital for something, you break your leg or whatever, you don't have health insurance, now you're 25, 30,000 in debt and that you can't afford. Number one cause of bankruptcy is medical costs. Yeah. But those are going to go way back up again, boys and girls. The other thing on top of that, so not just the Medicaid for lower income people, but food stamps. So I'm going to skip through this article a little bit and get to the food stamps part. So food stamps. The Republicans have been trying to cut SNAP forever. So SNAP is the Supplemental Nutrition Assistance Program, which is food stamps, and is perhaps the most important safety net program for people who are very poor. 75% of recipients are at or below the poverty line, and over 1 in 5 report having no other source of income besides food stamps. The share of single parents living on less than $2 a day is nearly 10% before you include SNAP benefits. Food stamps take the number below 3%, slashing it by over 2/3. Because the program grew out of efforts to prop up crop prices, redirecting surplus crops to poor people, it is the province for the Department of Agriculture and is renewed every 5 years in a farm bill. However, the last farm bill was 2018, didn't go into effect till 2019. It ends. And it expired on September 30th. So they're writing the new farm bill will be what they're doing next year. So Glenn Thompson, the Republican chair of the House Ag Committee, released his proposal farm bill in May. Its the most striking provisions would limit the ability of the Department of Agriculture to update its thrifty food plan, upon which SNAP benefits levels are based. This would amount to a $30 billion cut over a decade, and in response to the Biden administration updating the thrifty food plan, which resulted in a nearly 30% hike in the benefit levels. So right now, a lot of people are getting food stamps. A family of 3 is probably, like, just in Oregon, I looked it up, a family of 3 is probably getting anywhere between $600 to $800, depending on where they live in Oregon, a month for groceries. So that covers quite a bit. And then if you add WIC into that, I mean, now that's survivable. That's food for 3 people, and diapers and formula and all that stuff. Now that's going to get cut to probably about $300 or $400, back to what it was pre-pandemic. $300 or $400 is nothing for a family of 3.
no.
It's not going to cover anything. So these people are going to be really hurting.
Yeah, that would be me, for one.
Mm-hmm.
Right.
Yeah. I mean, so just so you know, that's kind of what we're looking at going forward. You're going to be looking at higher unemployment, more poverty, more kids going hungry, more people without health care, more credit debt, medical debt, things like that. And you're not going to be looking at an ultra robust market. going over the next 4 years. So it's going to be, we could be wrong. Maybe it all works out. Maybe Trump pulls it out and does a great job. And if he does, we'll give him credit for it. Believe you me, we will give him credit. But that's not what it looks like, and that's not what their plans are. Their plans are to make horrible cuts. So that's what we all got looking forward to in the near future. So.